I'm Mary McDonald, the CEO of Happy Valley Medical Centre. It's a 400 acute care medical hospital and surgical. Recently, we underwent the accreditation process with the Australian Council of Healthcare Standards. The feedback from this process noted and reported the significant non-compliance with medical record standards. I decided that we needed a task force to address the issues that were raised during the accreditation. I will now introduce you to the task force team members.
I'm Freddie Nurk, the Finance Manager. My role is focused on balancing incoming and outgoing funds, so my perspective is important when making any decisions that will have an impact on this. My department also borrows medical records to audit them, so we need to be involved and informed on the correct process to do.
I'm Leanne Brown. As a Chief HIM, I'm responsible for record keeping, tracking, storage, scanning center, data reporting, and health information staff training. The Chief HIM will be the core personnel for the task force. As the issues around the medical record, the Chief HIM will be the person lead other departments.
My name is Joanne and I'm a representative of the nurses. I have an understanding of what goes on day to day on the ward and how medical records are handled. If changes to the current system are going to occur, my knowledge is valuable to what needs to be improved and how it will impact our department. The manager of Outpatients, Judy Bucket, is also in the task force for similar reasons.
I'm Pete James, Director of Medical Services. I'm included in the task force as the medical staff need a complete medical record in order to do their job. We need timely access to health information and have a responsibility to document clinical information to a high standard. To a certain extent, I am responsible for making sure junior staff adhere to guidelines, especially in relation to timely completion of discharge summaries.
First, we brainstormed. This was each of us sharing our ideas without comments from anyone else in the group. This is what we came up with.
Workload,
File storage,
access,
Missing forms, medical record content, documentation lacking.
the poor use of the tracking system,
waiting time for file retrieval,
Coding backlog.
The quality of scanned records.
communication between staff, and the space and environment.
After we listed all the issues, we decided to give 10 points to all the participants to vote. Each issue can be scored from 0 to 10. 0 is not important. 10 is the most important. And the participants can rank it from 0 to 10. After participants voted, we list the top 5 issues as the most important top 5.
So I think that I will give a 4 to the medical record content, a 3 to the storage issues, a 1 to the workload, and a 2 to the environment issues.
Okay, from a nursing point of view, I give 6 to access to the medical records, 3 to storage, and 1 for workload.
As a Chief HIM, I'll vote 5 for the access and 5 for the MR content.
From the financial point of view, I'll vote 4 for the content, 6 for the access. And from the outpatient point of view, it's 6 from the access and 4 from the medical record content.
This is a summary of the top 5 problems identified by the task force. The task force looked at the process of scanning medical records and the ideal procedure that should be followed. It should start with the completed discharge summary, which then the ward clerk sorts. The medical record should then be picked up by staff from HIS, who will update the location of the medical record in the tracking system. The medical record is kept at a primary storage site and coded. After coding, the medical record is assembled for scanning and scanned. Once scanned, the medical record's status is updated on the tracking system. Once an audit is done on scanning quality, it is then moved from the primary storage site to the secondary off-site storage facility. Finally, the hard copy of the medical record is uploaded onto the tracking system. If someone requires a medical record from the emergency department, There is a process to follow. Ideally, the emergency department puts in a request for the medical record. If the medical record has been scanned, they can access it digitally. If not, depending on the time of day, two things can happen. If it's in the HIS opening hours, the request is received by HIS and they deliver the file to emergency. And this is updated on the tracking system by HIS. If it's out of HIS hours, the emergency department staff member collects the record from the primary storage themselves and updates the tracking system.
This fishbone diagram, or also known as cause and effect, helped the team to answer the question, what is causing medical records to go missing? The task force identified that insufficient storage space and a crowded dictation room were environmental factors contributing to missing medical records. For example, doctors taking more time to complete discharge reports as there was often a wait on the small dictation room, so files were delayed in returning to the HIS. Staff not following standard procedures regarding return and tracking of files, the time taken to scan records, and the time taken to scan records were methods causing missing medical records. Lastly, poor communication, understaffing, and lack of training and motivation to use the tracking systems were factors relating to personnel contributing to missing files. The task force decided to focus on the issue of medical records not being returned after they had been signed out. Medical records were being left in the emergency department ward or the outpatient clinic for long periods of time, which led to omissions and delays when scanning records. A check sheet was created in which medical records were counted in each area at the end of the week. This check sheet was used over a period of 12 weeks. The data was then presented in a Pareto chart, which shows the emergency department as retaining the highest number of medical records.
So what are some of the possible solutions we can put in place?
Like extra staff?
We could have satellite storage, so each department could have their own storage system.
Security guard or an escort for the person?
Well, if people are worried about coming to areas in dark when it's dark.
At night.
Yeah, fair enough.
And also trolling for the records, like for the OHS health and safety issues.
Yeah. We could have allocated return areas in each department so people know that's where they put their records.
Staff education.
People need to know how to use the system. Yeah,
definitely.
And also we can have a designated staff who are responsible for the return.
Good idea. So what criteria do you think we should use to assess our possible solutions?
Cost effectiveness.
Yep. Security, confidentiality, compliance with the records.
Yeah, and I think OH&S is important.
Yeah.
Will it reduce the missing record rate?
Yeah. And we want to make sure that we're not building or increasing anyone's workload.
Definitely, yeah, I think so too.
Each of the criteria that the task force came up with were applied to the possible solutions. If the criteria was met by the solution, a yes was recorded. If not, a no. From this, the 3 highest ranked solutions were identified. They were creating allocated return areas within clinics and wards, designating a staff member for returning or collecting the records, and staff education about the importance of following these procedures and about the importance of returning medical records more generally. The 3 solutions identified by the task force were put into place. Again, a check sheet was used to track missing medical records, checked out by various hospital departments over a 3-month period. This was done to assess the impact of the solutions implemented. From this check sheet, a run chart was created to help assess the success of the solutions. Looking at the run chart, you can see that there has been a reduction in the number of missing medical records. Following this action cycle, the task force met and had a celebration to acknowledge its success. Woo! They are now in the process of identifying the next area of focus to enhance the quality management of the hospital in relation to the tracking of medical records.
Turn down for what?